Why do teeth supererupt? There is this interesting sense that teeth have that's evolved. It's called proprioception. When one tooth touches the other, they signal to each other that everything's okay, everything's good, and that's where they should stay. If one of the teeth is removed, the other tooth senses that something's wrong and it wants to meet and touch the other tooth to get back into function. So this becomes significant when the remaining tooth wants to constantly keep growing, and it grows and grows and grows, but the root is not getting any longer. So it either becomes loose or it gets long enough and starts traumatizing the gum of the opposing jaw and causing ulcers. Also, if you want to have the tooth that you lost replaced, there won't be enough room to put another tooth there if the opposing tooth has taken that place. Also, over time, the remaining tooth will appear longer, so at the front of the mouth it's often unsightly. So it is generally recommended to replace the missing tooth, even if it's just for that reason. So when the remaining tooth grows out, it usually appears longer, can be quite unsightly. So even for that reason alone, it's generally recommended to replace the missing tooth, and the great way to replace it is with an implant, but a bridge or a denture will serve the same purpose.